Welcome back to the channel. Today we're tackling a topic that affects millions of people every single day: blood pressure. Now I know what you're thinking. I know how to take my blood pressure. It's simple. But what if I told you that small, common mistakes could be giving you inaccurate readings? This isn't just a minor inconvenience. It can lead to misdiagnosis, incorrect medication dosages, and a whole lot of unnecessary stress. Think about it. Your blood pressure numbers are a vital sign, a key indicator of your cardiovascular health. Getting them right is absolutely crucial for managing your well-being effectively and making informed decisions with your doctor. So how do we ensure the numbers we're seeing are the real deal? It all comes down to technique. An inaccurate reading can be just as dangerous as not taking a reading at all. That's why I want to empower you with the knowledge to measure your blood pressure like a pro, right from the comfort of your own home. That's why today we're going to break down the top 10 most common mistakes people make when measuring their blood pressure at home. We're not just going to point them out. We're going to walk through exactly how to avoid them step by step. By the end of this video, you'll have a clear, actionable checklist to make sure every reading you take is as accurate as it can be. All right, let's kick things off with mistake number 1, and it's a big one: using the wrong cuff size. This is what I like to call the Goldilocks problem. The cuff can't be too big and it can't be too small. It has to be just right. Why? Because the cuff's job is to evenly compress the brachial artery in your upper arm. If the cuff is too small for your arm, it's going to squeeze too tightly and unevenly, which can artificially inflate your reading, making your pressure seem much higher than it actually is. This could lead to unnecessary panic and potentially even starting medications you don't need. On the flip side, if the cuff is too large, it won't be able to apply enough focus pressure on the artery. It will feel loose, and the machine will struggle to get an accurate measurement, often resulting in a reading that's falsely low. So, how do you find the right size? Most cuffs have a range indicator or index line on them. When you wrap it around your arm, the marker should fall within the designated OK range. If it doesn't, you need a different size. Don't be afraid to use a measuring tape to measure your arm's circumference and check it against the manufacturer's sizing guide. Getting this right is the foundation for every accurate reading you'll take. Now that you've got the right size cuff, where you put it is just as important. Mistake number 2 is incorrect cuff placement. I see this all the time. People strapping the cuff way too high up on their bicep, almost in their armpit, or way too low, down on their elbow. The sweet spot is crucial. You want to place the cuff on your bare upper arm about 1 inch, or roughly 2 finger widths, above the bend of your elbow. This positioning ensures that the inflatable bladder of the cuff is sitting directly over your brachial artery, which is the major blood vessel running down that part of your arm. The tubing on the cuff should generally run down the center of your arm on the inside, in line with your middle finger. Many cuffs even have a little arrow or an artery marker to help guide you. Make sure you're aligning that marker with where you can feel the pulse of your brachial artery. If you place it too high, too low, or rotate it around your arm, the machine is going to have a hard time detecting the pulse waves accurately. This leads to errors or, you guessed it, inaccurate readings. Take those extra few seconds to find the right spot. Feel for the pulse on the inside of your elbow, position the cuff 1 inch above it, and you're setting yourself up for success. Let's move on to mistake number 3, and this one might seem obvious, but it happens all the time: measuring your blood pressure over clothing. I get it, it's convenient. You're in a hurry, you're wearing a long-sleeve shirt, and you think, it's just a thin layer, what's the harm? Well, the harm is in the numbers. Even a thin sleeve can act as a barrier, preventing the cuff from making direct, even contact with your skin and the artery beneath it. This interference can add anywhere from 5 to a whopping 50 points to your systolic reading. That's the difference between a normal reading and a hypertensive crisis, all because of a piece of fabric. And please, do not roll up your sleeve if it's tight. A tightly rolled up sleeve can act like a tourniquet at the top of your arm, constricting blood flow before the cuff even starts to inflate. This will absolutely give you a falsely high reading because the cuff is working against that pre-existing constriction. The rule is simple and non-negotiable. The cuff goes on a bare arm. Take a moment to remove the shirt or wear something with short sleeves when you know you're going to be taking a measurement. It's a small step that makes a huge difference in the accuracy of your results and ensures you're getting a true picture of your cardiovascular health. Mistake number 4 is all about patience, not resting before you take your measurement. Think about what you were doing just before you sat down. Did you just rush in from an appointment? Maybe you carried in heavy groceries or climbed a flight of stairs? Or perhaps you just had a stressful phone call or watched an intense scene in a movie. Any form of physical activity, stress, or excitement can temporarily raise your blood pressure. If you sit down and immediately slap on the cuff and hit start, you're not measuring your resting blood pressure. You're measuring your post-activity or post-stress blood pressure, which will almost certainly be higher than your true baseline. The official recommendation is to sit quietly in a comfortable chair for at least 5 minutes before you begin your first measurement. This isn't just a suggestion, it's a critical step. During these 5 minutes, your body has a chance to calm down, your heart rate can return to its normal resting state, and your blood vessels can relax. This allows for a much more stable and accurate reading. So, find a quiet spot, sit down, take a few deep breaths, maybe listen to some calming music, and just relax. Don't check your phone, don't engage in a conversation, just be still. Those 5 minutes of peace are an investment in accuracy. Okay, this brings us directly to mistake number 5, talking, moving, or having any distractions during the actual measurement process. You've done everything right so far, you've rested for 5 minutes. You're calm, but the moment the cuff starts to inflate, you answer a question from someone in the room, you check a notification on your phone, or you start fidgeting with your hands. Any of these small actions can throw off the reading. When you talk, you're using muscles in your chest and diaphragm, which can cause slight fluctuations in pressure. When you move, even just shifting in your seat or tapping your foot, you're contracting muscles, which also affects the reading. The blood pressure monitor is an incredibly sensitive device. It's designed to detect the subtle vibrations or oscillations in your artery wall as the blood pulses through. Talking, laughing, shivering, or any muscle movement creates noise that interferes with the monitor's ability to get a clear signal. This can lead to an error message or worse, an inaccurate reading, often on the higher side. The rule here is silence and stillness. From the moment you press the start button until the cuff has fully deflated and the final number is displayed, do not talk, do not move, do not text. Just sit there and breathe normally. It only takes about 30 to 60 seconds, and that small period of stillness is paramount for accuracy. Let's talk about gravity. Mistake number 6 is having your arm in the wrong position. This is a classic error based in simple physics. Your arm should be supported and positioned so that your upper arm, where the cuff is at the same level as your heart. Why does this matter so much? If your arm is hanging down by your side, gravity will pull more blood into your arm, and the machine will have to work against that extra pressure, leading to a falsely high reading. It can add as much as 10 points for every few inches your arm is below your heart. Think about that. A simple positioning error could push you into a higher blood pressure category. Conversely, if you hold your arm up too high, well above your heart, gravity works the other way. It makes it easier for blood to flow away from the arm, resulting in a reading that is falsely low. This could make you and your doctor think your blood pressure is better controlled than it is. The solution is simple. When you're seated, rest your arm on a table or armrest. You may need to use a pillow or a cushion to prop it up to get it to the perfect height, which is roughly mid-chest level. Your arm should be relaxed, not tensed from holding it in position. Supporting your arm at heart level neutralizes the effect of gravity and ensures the reading reflects your body's pressure, not your posture. This next one, mistake number 7, is a habit many of us have without even thinking about it, crossing our legs. It might feel comfortable or natural to sit with your legs crossed at the knee or your ankles crossed, but this posture can significantly impact your blood pressure reading. When you cross your legs, you are tensing muscles in your legs and abdomen, and more importantly, you are slightly compressing blood vessels. This can obstruct blood flow and cause a temporary spike in your blood pressure. Studies have shown that crossing your legs at the knee can increase your systolic pressure by 2 to 8 points. It seems like a small thing, but when we're aiming for precision, every point matters. The correct posture is to sit with both of your feet flat on the floor. Don't let them dangle if your chair is too high. Find a stool or some books to rest them on. Your legs should be uncrossed and your posture should be relaxed. This position allows for unimpeded blood flow throughout your lower body and torso, preventing any artificial increases in pressure. It's about creating a neutral, stable state for your entire body, not just your arm. So before you hit that start button, do a quick body check. Are my feet flat on the floor? Are my legs uncrossed? It's a simple check that ensures the reading is reflecting your cardiovascular system, not your sitting habits. We've talked about supporting your arm, but mistake number 8 is about supporting the rest of your body, specifically your back. Slouching or sitting on a stool without any back support might not seem like a big deal, but it actually forces your body to use muscles to hold itself upright. This isometric muscle contraction, even if it feels minor, can raise your blood pressure. Your body is under a low level of strain, and that strain will be reflected in the numbers on the screen. The goal is to be as relaxed as possible, and that's really hard to do if your core muscles are engaged just to keep you from falling over. The proper way to sit is in a chair with good back support. Sit back fully in the chair so that your back is straight and completely supported from your lower back up to your shoulders. This allows your muscles to relax. Combine this with what we learned earlier: feet flat on the floor, legs uncrossed, and your arms supported at heart level. You're creating a stable, relaxed foundation for an accurate measurement. Think of it as creating a zero-stress environment for your body. No muscle tension from poor posture, no dangling limbs, no constrictions. Just you, sitting comfortably and correctly, ready to get a true and reliable blood pressure reading. Mistake number 9 is a very common shortcut, taking only one reading and accepting it as fact. Your blood pressure is not a static number. It fluctuates constantly throughout the day, and even from minute to minute. The first reading you take is often slightly higher, a phenomenon sometimes called the alerting response. Your body might still be reacting to the initial sensation of the cuff tightening. Relying on a single measurement, especially that first one, can be misleading. It doesn't give you the most representative picture of your true resting blood pressure. It's kind of like taking a single photo of a busy intersection and trying to understand the traffic patterns for the whole day. To get a more reliable and stable value, the recommendation is to take 2 to 3 readings during a single session. Here's how to do it properly. Take the first measurement, then wait for 1 to 2 minutes before taking the second. This brief pause allows the blood flow in your arm to return completely to normal. After the second reading, wait another minute and take a third. Once you have your 2 or 3 readings, disregard the first one if it's significantly higher than the others, and then calculate the average of the last 2 readings. This average provides a much more accurate and stable data point to track over time and to share with your doctor. It smooths out any random fluctuations and gives you a number you can trust. Finally, we arrive at mistake number 10, and it's about the device itself, ignoring the calibration and accuracy of your monitor. You can have the most perfect technique in the world. You're rested, sitting correctly, cuff is perfect. But if your machine isn't accurate, your numbers will be wrong. Home blood pressure monitors are amazing tools, but they are not infallible. Over time, with use, bumps and drops, their internal components can lose accuracy. Using an uncalibrated device is like using a broken ruler. The measurements you get are essentially meaningless and can be dangerously misleading. So, how do you ensure your monitor is trustworthy? First, when you buy a monitor, make sure it's been clinically validated for accuracy. You can check product websites to see if your blood pressure machine is clinically validated. Then it's a good practice to have your monitor's accuracy checked periodically, at least once a year. The best way to do this is to take it with you to your next doctor's appointment. You can take a reading with your machine, and then your doctor or nurse can take a reading with their calibrated medical-grade equipment. If the readings are close, you're good to go. If they're significantly different, it might be time to get your device recalibrated or invest in a new one. don't just blindly trust the numbers. Verify your device. And there you have it, the top 10 mistakes to avoid for an accurate blood pressure reading. We've covered everything from cuff size and placement to posture and patience. It might seem like a lot to remember, but I promise that once you incorporate these steps into your routine, they'll become second nature. Taking a few extra moments to ensure your technique is flawless is one of the most powerful things you can do for your long-term health. Accurate data leads to better conversations with your doctor, more effective treatment plans, and ultimately, peace of mind. You are taking an active role in managing your health, and that is incredibly important. So I encourage you, the next time you go to measure your blood pressure, run through this mental checklist. Are my feet flat? Is my back supported? Is the cuff on my bare arm at heart level? Taking ownership of this process is key. Remember, while home monitoring is a fantastic tool, it doesn't replace professional medical advice. If you're consistently getting high readings despite using the proper technique, or if you have any concerns at all about your numbers or your symptoms, please make an appointment to see your healthcare professional. They are your best resource for interpreting these numbers and creating a comprehensive health plan. Thank you so much for watching and for investing this time in your health. I hope you found this guide helpful. If you did, please give this video a thumbs up and don't forget to subscribe to the channel and hit that notification bell so you don't miss our future content. And I want to hear from you. What's one thing you learned today that you'll change about your routine? Do you have any other questions about blood pressure? Drop them in the comments below. Let's start a conversation and learn from each other. Stay healthy, and I'll see you in the next video.